A fractured ankle can really throw a wrench in your plans. So joining us on the show today is Dr. Roberto Brandao to talk about the different types of ankle fractures and how to treat them. He is a board-certified, fellowship-trained foot and ankle surgeon at the Centers for Advanced Orthopedics, Orthopedic Associates of Central Maryland Division, in practice for over 50 years. Hello, I'm Caitlin White, and I've got a bone to fix with you. So let's start off here pretty basic, Dr. Brandao. What is an ankle fracture?
Yeah, so an ankle fracture is a broken bone or fracture of the distal or end part of the leg. The ankle is comprised of the tibia and fibula. That ankle joint helps us to move our foot up and down. And when we break our ankle, generally speaking, it's out on the outside bone or the fibula, or sometimes called the lateral malleolus. And that's when you have a broken bone of that from an injury, a fall, a twist, or even sometimes an accident. Also on the tibia, or the larger leg bone, sometimes more so thought of on the inside part of the ankle, that can break in a similar fashion. And you can have a break of something what's called the medial malleolus, or the inside part of the ankle bone. Some of them are very simple and sort of easy, and some of them are very difficult and can be worse, depend on what happens if anyone was in a car accident, or if you were just maybe even playing soccer or basketball. It varies on how bad they can be.
So you touched on my next question a bit already, but what are the different kinds that can occur?
Right. So yeah, there's several kinds and several classifications that we use to talk about ankle fractures. But like I was saying before, I think understanding just mainly inside and outside are very important, but also not to exclude the bones, but there's also a lot of soft tissue damage. So sometimes there can be sort of a high ligament rupture. Some people think of that as a high ankle sprain. But when we have broken ankle bones, the soft tissues also can be injured and damaged that need to be addressed as well. So we can have, as far as general types of ankle fractures, we can have ones that have rotational injuries, some that have impact injuries, some that have dislocations, and those get to be more severe and often need to be treated with surgery.
So if I fall or somehow injure my ankle, what does that feel like? I mean, is it something that I might not know happened, or do I pretty much know? When should I head to the doctor?
Yeah, that's a great question. Let's say something happens where you're playing basketball and you come down and you injure your ankle and you feel immediate pain and swelling. Mm-hmm. It actually can be very difficult to walk and place weight on your foot, and that could be very much true of an ankle sprain where you don't break anything. It's very difficult to know if you've broken anything in particular, but some patients will hear a pop or a snap, and that sometimes can be an indication. Sometimes also, unfortunately, you can see your foot in a different direction, and that would kind of give you an indication that something is not right, I guess you'd say. And then in very rare cases, this would be more so in the higher energy, your bone can unfortunately come through the skin, and we call that an open fracture, or sometimes people will call that a compound fracture generally. So it's very important to go to the doctor when you are unable to bear weight, when you're having a lot of swelling and pain in the ankle, to get evaluated. It could be something as hopefully as simple as a sprain, or we may be evaluating for a fracture of the ankle.
So if I do end up having a fracture, what does treatment look like?
Treatment for an ankle fracture can vary in the non-operative or conservative role to operative. And a lot of ankle fractures actually can be treated well without surgery if they do not have a level of displacement or any level of dislocation. So that means if the bone is not too shifted out of place, then generally speaking, we can treat people very well with a splint, a cast, or a boot to keep their ankle immobilized. Now, if it is dislocated or the bones are displaced, meaning they are shifted out of the normal accepted range for healing, then that's when we have to do surgery. Surgery usually will require a mixture of hardware, whether it be plates or screws, to put the ankle joint back in the normal aligned position that it was in prior to the injury. And fixing the ankle and putting it back into the appropriate aligned position is really helpful to avoid later issues, including post-traumatic arthritis or continued pain to the ankle. So your doctor will evaluate the x-rays as well as the soft tissues, and maybe even do some additional x-rays or even some advanced scans to take a look at how many components of the ankle are broken before making a decision on whether to treat this conservatively without surgery or pursue surgery.
So is there anything we can do to keep our ankles strong or avoid fractures in general?
Yeah, that's a really good point, especially considering, we have a lot of people in our advanced age population that are a lot more active than they used to be, a lot more hiking, a lot more running into the later years of life. So yeah, general overall bone health is really, really important, and I'm glad you brought that because, sometimes an accident will happen, and that's why they call them accidents, as my dad says, you can't plan for it. And, obviously in that scenario, you just got to be careful and try your best to be safe and not injure yourself, just like any other circumstance. But with that being said, you can optimize your bone health, making sure that you're getting adequate amounts of vitamin D, calcium, and you don't have any other underlying issues that would lead to osteopenia or osteoporosis. That way, if you just had a small little accident, it doesn't end up turning into an ankle fracture, which is unfortunately something I do see quite often in our elderly population with simple things just as a misstep off of one step or even unfortunately just off of a curb, which can happen to anybody. But, with proper bone health, I think that hopefully gets reduced.
Well, doctor, some good tips here. Is there anything else we should know about ankle fractures?
Well, I really think you sort of had some great questions about when we should go, and I think that's really the key here is making sure if you're unable to bear weight or if you're having swelling or a lot of pain, please go see your doctor, go see an orthopedist or foot and ankle specialist and get evaluated. I think that's key to making sure that you can be treated appropriately and quickly, which can ultimately have a nice effect and improved return to activity.
Well, we thank you so much for joining us today. That was Dr. Roberto Brandao. He is a board-certified, fellowship-trained foot and ankle surgeon at the Centers for Advanced Orthopedics, Orthopedic Associates of Central Maryland Division. Find more about us online at mdbonedocs.com. And please remember to share and subscribe to this podcast. That's all for today. I'm Caitlin White, and that was a bone.